Let's look at endometriosis, endometriomas, which are cysts of endometriosis, often called chocolate cysts, and the impact of removing them on IVF and on ovarian reserve. Now, endometriosis cysts are often seen, and the standard practice sometimes to surgically remove this cyst before women go for assisted conception or reproductive technologies. Now, the treatments like IVF are based on the belief that it would improve the chances of getting pregnant. However, recent research challenges this approach. This comprehensively analyzed studies comparing women who had surgery to remove endometriomas before assisted conception. The key finding was that surgery does not improve the pregnancy rates, the live birth rates, or fertilization rates. In other simple words, women are just as likely to have a successful pregnancy with assisted conception, whether or not they have surgeries to remove the cyst. So let's look at the study. The review found that surgery can actually reduce ovarian reserve, which is the number of eggs left in the ovary, measured by a lower anti-Mullerian hormone, and fewer antral follicles. The meta-analysis consisted of 8 studies and found that after cystectomy, that is, removing of the cyst, serum AMH dropped by an average of 1.53 nanogram per ml, and this was statistically significant, leading to a decrease in ovarian reserve. The antral follicle count, also multiple studies show that surgery had significantly lowered antral follicle counts compared to those who did not. The number of oocyte retrieved was slightly lower on those who've had surgery, and the reduction was greater when compared from an operated to a non-operated ovary on a rate of almost 3.4 fewer oocytes. The number of mature oocytes was also lower in some studies, and women who required surgery required higher doses of FSH for ovarian stimulation, and with one study reporting a significant increase in the FSH doses. The cancellation levels also were higher, almost 13.7% in women, which means that women may have had a lower number of eggs, thus risking cancellation. So, what does that mean for clinical care? That routine surgery before IVF is not necessary in women with endometriosis. Instead, it should be individualized. Where and when should you operate? Surgery is appropriate if cysts are large, more than 4 centimeters, and you just can't see the ovary. They cause pain or make it difficult to even approach with a needle during IVF. In those cases, you must operate and you must relieve the pain or just decrease the size of the ovary. Otherwise, skipping surgery into small cysts may be reasonable. Why is it again important? Because there is a general lack of consensus of what happens in the world of medicine, and what we need is probably more studies to look at this matter. And that's the reason why it's quite an important paper. Something which often gets done is doing surgery on endometriosis, but looking at those cases where there is extreme pain, where cysts are very large, where you can't get to the ovary is completely compressed. In those cases, I think doing surgery seems reasonable.